parity is definitely important, especially in a civil and democratic society. Unfortunately, despite the fact that we live in a land of so much opportunity, the playing field isn't level. And because the playing field isn't level, people confuse bad outcomes with bad people. So the question is, what are the things that need to be done in order to allow people to participate in the opportunities that create the outcomes? You know, one of my favorite examples is around the Rooney Rule in the NFL. For a long time, people of color weren't even considered for coaching jobs. And then they put in a rule, it's like, we're not saying you have to hire them, but we're saying you have to at least talk to them. You have to at least consider them. And within a few years of the rule being put in place, not only did you have more African-American coaches being hired, but you had two in the Super Bowl playing each other. And so that's an example of how just creating the opportunity for consideration, you know, the parity of access is sometimes the key obstacle to getting a better set of results. If I were, you know, so fortunate at the end of my career to be able to say that somebody was actually inspired by anything I did, I would hope that it would be around one of three things. I would hope that it would be either around education and its importance, you know, not just as individuals, but as entire communities and as a nation, entrepreneurship, and pursuing passion. Now, some of that is around being creative, some of that is around controlling your own destiny, but most of it is around following the thing that excites you the most. And then the third is around doing the things that help us live longer, healthier, and more purposeful lives. Those are the things that I tend to be focused on, and I hope that at least some of the work that I'm doing could one day inspire somebody in one of those areas. The one thing that I'm focused on today is trying to move to a world where people don't die from cancer. And so there's a lot of ways to think about that, but the most critical way to think about it is that cancer today is lethal. And I'd love to move towards a day where it's not. Doesn't mean it goes away completely, but move it to common cold status. It's just something you get, but it's manageable and treatable. And because that's a focus, I've been working with a number of groups and a number of organizations that focus on really innovative treatments for cancer. Some of them are immunotherapies, some of them are more advanced science. But the key is that they're all making critical strides and advances. You know, whether it's Tokogen out in San Diego focusing on brain cancer, whether it's Dr. Carl June in the Abramson Center at University of Pennsylvania and what he's doing with leukemia and lymphoma, there's a lot of people who are actually making critical strides in advancing towards this day where people will not have to die from cancer.